Hello everyone, my name is Mohammed Ajab. I'm one of the internal medicine residents in Amita St. Francis Hospital in Evanston, Illinois. On behalf of our team, I have an interesting patient to discuss with you. Our patient is a 78 years old lady with past medical history of pulmonary sarcoidosis that was diagnosed incidentally 12 years ago. She did not require any specific treatment at the time. She presented to our hospital with generalized weakness, weight loss, back pain, and mild abdominal discomfort. Her physical examination was significant for midline spinal tenderness, shifting dullness was positive for ascites, and there was lower extremity weakness without sensory level. Her laboratory workup showed normocytic anemia, low albumin level, and elevated calcium when corrected to albumin and deranged liver enzymes. Imaging studies in form of MRI of the spine showed multiple lytic lesions involving the vertebral bodies of the lumbar and the thoracic spine vertebrae, as you can see here in these T2 weighted images. A contrast CT of the chest showed bilateral calcified pulmonary nodules involving the upper lobes. There was also calcified bilateral hilar lymphadenopathy. A non-contrast CT of the abdomen showed ascites, nodular hepatomegaly, splenomegaly, and bilateral renal lesions. The patient underwent biopsy of the liver and the lytic lesions from the bone. The bone marrow biopsy showed a non-caseating granuloma, as shown here in this H&E staining, with multiple multinucleated giant cells. You can see this more clearly here in a close-up view. The biopsy were negative for special stains for Mycobacterium tuberculosis and other fungal infections. Immunohistochemical staining for CD31 was also negative, as well as in situ hybridization for kappa and lambda light chains. The plasma cells that were present were polyclonal. So our patient was diagnosed with multisystemic and vertebral sarcoidosis based on her previous past medical history and the pathology shown previously. Multisystemic sarcoidosis is a diagnosis of exclusion. Sarcoidosis in general involves the lungs, the skin, and the lymph nodes, but it's not uncommon for sarcoidosis to involve other organs. Most of the time, this involvement can be subclinical. The differential diagnosis of multisystemic sarcoidosis is wide. It includes chronic infections such as tuberculosis and histoplasmosis, autoimmune conditions such as Crohn's disease, malignancies such as multiple myeloma and lymphomas. Biopsy is the standard to diagnose osseous and multisystemic sarcoidosis, as imaging can be misleading. Our case illustrates the importance of keeping a wide differential diagnosis when approaching patients with lytic lesions. Steroids remain the standard of care in treating multisystemic sarcoidosis. Our patient reported significant improvement in her back pain after treatment with IV methylprednisolone and oral prednisone later. Thank you very much for listening. I'll be happy to answer any questions at my email muhammad.agab@amitahealth.org. Thank you.